Thank you so much for joining us for this HelpNet webinar, Moving Beyond Leaving Our Problems at the Door, Mental Health in the Workplace. My name is Casey Coker. I'm a psychotherapist. I work with Bronson Healthcare Group and HelpNet Employee Assistance Program. So our objectives today, we're going to talk about what is mental health and describe the ways in which it impacts our lives. Describe how unaddressed mental health challenges can impact us at work. And we're going to work on identifying ways to better manage our mental health and support others in managing their mental health in the workplace. So I invite you to just take this moment to relax your shoulders, soften your jaw, take a long and slow inhale, and then a longer and slower exhale. The magic of the breath is really in that long and slow exhale. When we can breathe in and out of our nose, that helps calm the nervous system. I also invite you to soften your gaze, rest your eyes, find some comfort in your body, scan your body for any tension or stress, and allow yourself to bring comfort to any tension or stress that you have in your body. And now let's just be in this moment as much as we can. So mental health is health. The brain is an organ inside of your body, just like any other organ, just like your kidneys or your pancreas. And so we want to be mindful that this illusion we have around mental health is separate than physical health is not only wrong, it's dangerous. So when we think about brain disorders like dementia or Parkinson's disease, we take those very seriously, and we would never tell someone to not take their medication or to not seek adequate support for those brain disorders. And when it comes to mental health, it's the same. So we want to be conscious of not diminishing someone's mental health, depression, anxiety, post-traumatic stress disorder, mood disorders, just to name a few. We want to treat those with the same care and compassion as we would any other health issue. You would never tell someone with diabetes to stop taking their insulin without their doctor's or physician's guidance. So we should really never be advising or suggesting people what to do or telling people what to do about their mental health. We should support them in seeking professional help, professional support, just like we would with any other health condition. What is mental health? Mental health includes, but isn't limited to, our emotional and psychological and social well-being. It affects how we think, how we feel, what we feel, how we act, and our behaviors. It also helps us determine how we handle stress, relate to others, and make choices. It directly impacts our physical well-being. So in the last several years to decades, we've had what is called an increase in deaths of despair. Now, deaths of despair are those related to death by suicide, substance use and abuse, cirrhosis of the liver, things that are usually related to untreated mental health challenges. And so we're seeing increases of that over the last several years and decade. Largely because we're not treating mental health with the same care, compassion, intentionality, and significance that we treat other health challenges. And so we really want to be conscious of taking these things seriously so we don't self-medicate or hurt ourselves as a way to treat our undiagnosed or untreated mental health. So being conscious that deaths of despair are ways that we are coping with unhealthy ways of coping with mental health because we are so shamed and there's such a stigma around getting actual professional mental health treatment. So there are about 1 in 5 people who have a diagnosable mental health challenge. So that's about 20% of the population. I encourage you to think about 1 in 5 folks in your workplace. 1 in 5 folks in your family, your friend support group, your children, 1 in 5, 20% of folks have the enough of the symptoms to be diagnosed with a mental health challenge. And that includes you and me in that 1 in 5. So why am I pushing so hard to treat mental health like physical health, like health? Because the onset of symptoms for our first symptoms related to mental health or mental health challenges, it takes about 8 to 10 years for people to go from symptoms to professional treatment if they get treatment at all. Now, think about the damage that untreated symptoms can do in a person's life for 8 to 10 years. So, we can prevent that by closing that gap. So, when we first start noticing symptoms related to mental health, we're feeling increased anxiety or fear, we're having a hard time sleeping, or we're sleeping too much. We notice that we're just not on our game the way that we usually are. There's something going on with us, or there's something going on with someone in our world. If we can close that gap from symptoms to treatment to months, rather than 8 to 10 years, think about the quality of life we can improve for people and their families and their coworkers, and the lives we can save related to death by suicide or substance use. 8 to 10 years is unnecessary. We can close that gap by treating mental health like the health it is. I also want to lift up that talking about suicide does not cause suicide. So, as the famed researcher Dr. Brene Brown says, when we meet shame with empathy, we can dissolve the shame. So, by talking about suicide, talking about having thoughts of suicide or feelings of suicide, or asking people if they've thought about suicide, does not cause it. It lets people know that you care. It lets people know that you need help. It lets people be a support for you, or you a support for others. It lets people know that you are not alone. So we can't be afraid of talking about suicide, because we want to be able to treat it. We want to be able to support folks who are in that space, including you if you're on this call. So talking about suicide, whether it's your thoughts or someone else's, helps people get the help they need, and it keeps them alive, and that's what we want. So when we talk about mental health, the challenge is, like this iceberg, the thoughts, the feelings, the history, we can't see that for someone else. All we can see is their behavior. And so we have to be conscious that under that behavior is usually a reason for that behavior. So someone might be having worried thoughts or scary thoughts or sad thoughts. They might be feeling overwhelmed with feelings of fear and anxiety, sadness, hopelessness, helplessness. They might have a long history or short history of trauma or experiencing hard things. So we have to be conscious that under these behaviors that we see and we often judge, there's a reason that we just can't see why a person is behaving in that way. But behavior is a clue. It's something we can identify and say, I wonder what's going on here for me or for someone else. And with that, I want to be mindful of saying that happy doesn't equal healthy. The goal in life is not to be happy despite what every meme on social media says. The goal in life is to have all the feelings and emotions, because emotions are clues. They say, this matters to me. Sadness says, this was important to me. Anger says, this violated my boundaries, and this is not okay. And grief says, I lost something or someone I truly, truly cared about and loved. And so with those data points, we learn about ourselves and we learn about others. We learn what matters to us, what our values are, what's important to us. And what's important to understand is emotions and feelings are not behaviors. So anger is healthy, but being cruel and abusive is not healthy. So we often entangle those two instead of identifying the emotion and the feeling that's underlying the behavior. So again, being angry makes sense and is okay, but being hurtful does not. Being sad is okay, but isolating yourself and disconnecting from others is not. So there are healthy emotions and sometimes unhealthy behaviors that go along with those emotions that we've learned to cope with. So what's really important to understand as well is that when a person expresses an emotion, we have to really try hard not to invalidate them and or gaslight them. So that's when someone comes to you and says they're angry or they're sad or they're frustrated, and you say things like, you're making that up, or I never said that, or I didn't mean it that way, or why are you so sensitive? We want to try not to diminish another person's experience, even if it's different from our own. So if you remember the iceberg, we all have different icebergs. We all have different ways of seeing and experiencing and feeling the world. And ours experience of the world isn't right or wrong, and someone else isn't right or wrong either, even if they disagree with us. So we want to try to use that curiosity and wonder to understand where a person is coming from. What is this emotion? What is this behavior saying about this experience for them? And we want to try hard not to invalidate or diminish that experience for another person. How do we do that? We use validation and empathy. So empathy really centers on what is this other person's experience. So someone comes to you with a strong feeling or emotion, and you say things like, thank you for trusting me with this. I'm here and I'm listening to you. I understand why you would feel this way, even if in my head, I wouldn't feel the same way in the same situation. Understanding why someone else would feel that way doesn't mean you agree with it or you feel the same way. You are understanding why they feel that way. And you can say things like, I'm sorry, how can I make this better? I'm here, I support you, I hear you. How you feel matters to me. So just like when you get your lab reports back from the doctor and they have a reference range, understanding that mental health is the same way. So we all have our own mental health reference range. So that's why we can't compare our experience to another person. So what might be healthy for me might not be healthy for another person. What might be normal sadness for me might not be normal sadness for another person. So mental health, just like every other aspect of our experience, is unique to us. It's unique to our physiology. It's unique to our lived experience. It's unique to how we show up. And so really not comparing ourselves or offering advice or suggestions to someone else about their mental health, because when we offer advice and suggestions, we often do that from our own reference range. Now, if someone is asking explicitly for your advice, then you can say, this is my experience. But understanding that we each have unique ways of showing up related to our mental health, our emotional health. And so we want to be conscious and compassionate, not to compare our experience to another, because that will often diminish our own experience. And this can lead to that gap in mental health treatment. So understanding that we all have changes, or we all have that reference range, what are some clues we can see in people's behavior, that top of the iceberg? We can see that folks have increased irritability, changes in sleep patterns. So this is someone who maybe sleeps a lot more or less than they have historically. Increased anxiety and fear. So anxiety is that feeling of overwhelming fear. Something bad happened, or I did something bad, I am bad. Changes in eating patterns, so eating more than usual or less. Increased sadness, anger. Now we know that emotions are healthy, but when they dominate our world and they take over, those are clues that something's going on. Changes in our social connections. So we are pulling away from folks, we're disconnecting from folks, or for some folks, we're reaching out and connecting with folks in ways that we haven't in the past that isn't healthy for us. Increased substance use. So this could be food, alcohol, drugs. It could also be TV, gambling, video gaming. So really just ways that we distract ourselves from taking care of ourselves or addressing what's going on in our lives. So specifically as it relates to work behavior, increased absenteeism or tardiness. So someone who was pretty prompt in the past is now calling in more often or not showing up on time. Decreased focus and productivity. So someone who used to, respond to emails in a certain way, or productivity is now diminished. Someone now is withdrawn from typical social behavior. So if someone would respond or text or connect on a regular basis is now pulling away, or someone who has been, pretty consistent in their behavior is now asking for more connection or support. Increased defensiveness, reactivity, decreased self-care. So someone who's maybe not keeping their same grooming habits up that they were before. Increased outbursts or just changes in personality. So we really want to look at these behaviors from that top of the iceberg, and we want to come at this with some care and compassion. We don't want to assume this person is trying to not do their job or is being lazy. We want to come at this from that something different is going on for this person, and we want to understand what that is and how we can support them. So some scripting. If you notice that someone's behavior is changing, we can observe that and we can acknowledge that. So we can talk to people we work with, like, how are things going? I've noticed that you are not as blank as usual. So communicative, engaged, I want to check in. We can explicitly ask people, what can I do to support you right now? What do you need from me to feel supported? What does success in this role look like for you now? Because we can't assume that we know what support means for someone or what support is defined as for someone. So we really want to ask that question. And we also want to make sure that we're in agreement with the folks around us about what success in these roles look like. So what does success mean to me, and what does it mean to you? Or what does respect mean to me? Or what does productivity mean to me? These words don't have specific definitions that are universal. So we want to give the benefit of the doubt. We want to assume positive intention when we can. So we want to give people the chance to answer these questions for themselves. And as coworkers and as leaders, we can get on track with people once we have some definitions to work with. So the first thing that you can do is, if you are recognizing yourself in this webinar, is to acknowledge that maybe something is going on. So that's that first step, is saying, maybe there's something going on with me that I need to talk through with somebody else. So that first step of acknowledging, I need to work on something. And then with another person, seeing someone and saying, how you feel matters to me. Are you okay? Do you feel supported? What do you need? I'm noticing things have changed for you. People want to be seen. They don't want to be fixed. They don't want to be saved. They want to be seen and acknowledged for who they are and how they are. So taking that risk and stepping out and saying, I see you. What's going on with you? And making space for that person to answer honestly, and you responding with empathy and understanding. We want to, again, try to stay away from fixing, saving, or advising unless the person explicitly asks for that. What are some treatment options? We have psychotherapy, which is a wonderful resource and that I think every person should utilize at some point in their life. Medication, which is sometimes necessary and appropriate in the healthy outcome. The goal should not be getting off your medication or not getting on medication. It should be what can help me be as healthy and supported as possible. Social support and peer support, spiritual support, religious support, spiritual communities, patience and self-compassion, talking to yourself like you would talk to someone you love, dietary support, exercise and movement. So tending to the needs of your body. So I ask you to think about this for just a moment. What is your favorite version of yourself? Who are you with? What are you doing? Where are you? Be very specific. What do you need to have this version of yourself as often as possible? Who do you need to be with? What are you doing? Where are you? So thank you so much for participating in this webinar. Again, my name is Casey Coker. I work with HelpNet Employee Assistance Program. As you can see on your left, that's our contact information. We are available for you 24 hours a day, 7 days a week, 365 days a year. We have resources like this webinar, psychotherapy, lots of different support options for you. So I encourage you to reach out, call this number, ask some questions. This is for you and anyone in your household. Psychotherapy is a wonderful, wonderful intervention that can help support you to get your mental health needs met. So again, thank you so much for participating in this webinar, and we'll talk soon. Bye-bye.